Use putty PVS impression material with mandibular eastern tray to collect the teeth position, centric relation, and the VDO information. If the patient can open wide enough to allow both maxillary impression and mandibular trays to be inserted together, secure the maxillary eastern impression to the mandibular eastern tray using elastomers. Use 1:12 ratio for catalyst to base. Mix them and apply the putty PVS impression material at the tissue side of mandibular eastern tray. Put less moldable material, leaving buccal and lingual support area not covered, especially the lingual area. It is a little difficult to do the border molding at this stage. You want to focus on the teeth position and occlusal relationship, not want to have overextension of the border. See the maxillary eastern impression with mandibular tray completely in the mouth. If the maxillary impression is not stable due to severe ridge resorption, apply a small amount of denture adhesive to stabilize the maxillary eastern impression in the mouth, so you do not need to hold the impression in place with your hand. If the patient cannot open wide enough to fit both trays in simultaneously, leave the elastomer on the hooks of maxillary eastern impression and seat the maxillary eastern impression in the mouth. Then add moldable material to the tissue side of the mandibular tray and insert the tray into the mouth. Hook the 4 elastomer from the maxillary eastern impression into the hooks of the mandibular eastern tray. This will free your hands to record centric relation and VDO. If the hook on maxillary eastern impression was trimmed away when you're adjusting the maxillary eastern impression, or it is too difficult for you to put elastomer from maxillary hooks to the mandibular hooks, you can just use one hand to hold the mandibular tray and guide the patient to bite into centric relation using the other hand. Guide the patient to bite at centric relation slowly into the preset VDO using eastern measure. Once the jaw is at the correct position, make sure the patient stay in this jaw relationship. You can watch the video how to record centric relation to learn different ways of getting centric relation. Use your finger to press the material into the buccal and the labial vestibule in case there's some actual moldable material pushed out to the border. Then use the lip to mold the border. Remove the 4 elastomer and separate the maxillary impression with the mandibular tray. Hold the mandibular tray in position. Use your fingers to press the material thin into the lingual vestibule, especially the distal lingual vestibule and the retromolar pad areas, in case there's some actual moldable material pushed out to the lingual border. Let the patient move the tongue around to mold the lingual border. By the time the elastomer is removed, the putty PVS impression material might be partially set. It might be difficult to mold the border very well. This is why you should not put too much moldable material in the lingual. Putty impression material will self-set completely in about 5 minutes. Now you have a customized mandibular eastern tray that recorded teeth position and jaw relationship.